One, hello, hi. Good to have you here on our live session. Thank you so much for joining. I hope you all can hear me. Let's just wait for a few minutes before we start. Let's wait for a few minutes. If you can see the live chat, I would love you to just drop where you're joining from.
Hello. Hi.
Hello,
How far?
Adas.
Finally, it's working now.
Thank you so much. And we'll be starting. Thank you so much. As you join, do well to find the live chats and comment where you're chatting or you're listening from. Ajiboye. I'm a pharmacist and a health promoter. I'm also the founder of a Healthier Life initiative where we focus on health advocacy and health promotion. So quickly today, very, very essential topic, a topic everyone we ought to understand every bit of it is why people die. I mean, here as heard about it like that, you hearing someone you saw yesterday and then that's tragic occurrence. So this is why we need to know about it, the various causes and how to prevent it. So I have here that is going to be it's me, Dr. Adebiyi Adeshewa. So briefly, with pleasure in my heart, I'm going to be introducing our first person for today. Adebiyi Adeshewa is a highly motivated medical doctor with 3 years of experience in providing exemplary patient care, exceptional, and has solid enthusiasm towards project management, telemedicine, research, and public health. She's passionate about providing holistic care to patients, and she has strong focus on listening to and addressing patient concerns and answering up questions in terms of patients. She has an MBBS, that's Bachelor of Medicine, Bachelor of Surgery degree in Medicine and Surgery from Afe Babalola University, Ado Ekiti, yes. She has participated in several outreaches. Most recent is the campaign against cervical cancer, which she led. About 50 adolescents were vaccinated against human papilloma virus. She's also a health and fitness enthusiast, where she trains people on how to make healthy choices as regards food and exercise. This is amazing. So, with a clapping ovation, I would love Dr. Adeshewa to please have the floor. Briefly, she should just explain, in layman's language, when we hear, okay, he slump and died, she slump and died. What are, the various causes behind this? You can just briefly just explain to us what can actually lead to this. When we hear about someone slumping and dying, is it that the person did something wrong, or the person could have done something, or the person has a problem, in the system or something? So, Dr. Adeshewa, please, you have the floor.
Okay, thank you so much, Eniola, for the opportunity to be here. I'm so grateful, and I'm really honored to be here. So, for the purpose of this webinar, we'll just go straight. We'll just dive right into why we're here. Slump and die. When I was told the topic, it's quite broad because in medicine there are like 1001 things that can make people to slump and die. But today we'll just narrow the causes to the most common cause, the common things that happen in lives that can make people to slump and die, especially especially in Nigeria that we are in. So I will be narrowing it down to I will be emphasizing more on prevention because you really do not need to know so much about how the diseases, occur. The most important thing is you are aware on how to prevent this from happening to you or, any of your family member. So I'll be dividing the causes into the common causes in the young, then the common causes in the older generation. So when I mean young, people that are less than 40 years, I'll be using the age 40. So less than 40 years is classified into the young for this webinar. Then greater than 40 years, that is people in the older generation. So I'll be talking about the causes, just common causes in those, that age group. I want what we call atherosclerosis. It's like the basics to um, these medical conditions build upon. Atherosclerosis can be found in literally most of the causes of sudden death. So it's very important for us to have background knowledge on how atherosclerosis occur. So once I explain atherosclerosis, then we're good to go. So I'll be using this paper as a means of illustration. So I'm going to fold it, right? So I'm going to fold it. So when I mean atherosclerosis, I'm talking about your blood vessel. Like when you hear atherosclerosis, it's relating to your blood vessel. So we have different, vessels in different organs of our body. We have the heart, we have the kidneys, we have the brain, your liver. Each of these organs, they have their own blood vessels now. So this paper now, let's just assume this is your blood vessel. This is literally how our blood vessel looks like, and it is in layers. You can see that the paper is rolled in layers. So that is how your blood vessel is in layers, right? So imagine a stone is staying at the middle part of this paper that is your blood vessel. So once there is an obstruction, let's imagine it's like a stone now, it will cause a narrowing. It will reduce the blood movement from this point to the other part, right? So atherosclerosis is just the narrowing of the blood vessel. So when this has happened, it leads to myriad of events. It leads to sequence of events that can end up into the person slumping and dying from there. So atherosclerosis is um is like the basics of which these conditions build upon, and what can cause a stone to form in any part of your blood vessel. I'll be discussing this, and I'll be explaining more as I move on. So let's generation. So for people in the older generation, I'll be talking about cerebrovascular accidents. Language, a lot of people know cerebrovascular accident and stroke. So what is stroke? So stroke is a sudden onset, rapidly progressing, you know, focal or global neural. So when just stay with me. Anytime I, talk about a big medical term, I'm going to can. because I want you to get this. So, sudden cerebrovascular accident occurs suddenly. It's not something that tell you that I'm going to occur in 2 weeks. It's a sudden onset and it rapidly progresses within seconds. It progresses very fast, and it is a neurofocal or global neurological deficit of vascular origin. That is why I explained atherosclerosis. So stroke is usually of a vascular origin. It is from a vessel. It is starting from a vessel, and it can either lead to ischemia. What I mean by ischemia is lack of oxygen. In this the blood carries oxygen. It carries oxygen to different organs in our body, especially the heart, the brain, the kidneys, all the organs in the blood carries oxygen. So when there is something that limits flow of blood from one point to another, a part of the organ will not get enough oxygen. So when this occurs, it leads to stroke. When this occurs in any part of the spinal cord, it leads to stroke. When this occurs in any part of the retinal vessels, that's the blood vessels in the eye, it can also lead to stroke. So those are the three major areas that stroke can occur: in the brain, in the spinal cord, and in the retina. So that is what stroke is basically. And also, there can be hemorrhage. It is either ischemia, that is lack of oxygen, or hemorrhage. So a part of the vessel can suddenly burst or can suddenly give way. The movement of the blood is streamlined, is controlled by the blood vessel. So imagine a part, no, I cannot do this anymore. So there will be spillage of blood to every region. Just imagine it in the brain. So once lapses into unconsciousness, and if time the person dies. So that is what stroke is. And it is not just in the old, because research is showing now that it is also happening in the young. Like, it is happening, the incidence is increasing day by day in the young, but it is more in the older generation. I hope you're understanding what I'm saying. So what are the things that can predispose you to having stroke, right? Number one, controlled hypertension. Uncontrolled hypertension. If you have hypertension and you're taking your drugs and it is controlled, you are being checked regularly by a medical practitioner, you may not, throughout your lifetime, someone that you skip your medications, you don't even know you have hypertension to start with. You do not go for your regular checks. You don't even know what your blood pressure was last month or the month before. You have no idea. Those are the people that are prone to having stroke, because stroke occurs when there is uncontrolled hypertension. But if your blood pressure is controlled, you are good to go. I hope you're understanding what I'm saying. Okay, so uncontrolled diabetes mellitus can also predispose you to having stroke. A lot of things. Uncontrolled hypertension, uncontrolled if you have sickle cell anemia is also another medical condition that can predispose you to having stroke. So how can you, or before I talk about prevention, how we having stroke at the moment? Number one, someone, a family member, or you suddenly one part of your limbs are one part of one or one part, there's something we call tuning. Then that is what transient ischemic attack is. You may feel this weakness in one part of your face, you are good to go, and you think everything is fine. You just had a transient attack, and if care is not taken, you can have the main stroke itself. So once you notice that in any of your family member, or maybe your mom calls you and they tell you they noticed that they suddenly can't lift the right hand, they suddenly can't lift the right leg, and or maybe their speech is slurred or slowed. If you notice that they're speaking as audible as they use in hospital. So how can you prevent stroke? The most important thing is to check your blood pressure. When was the last time you checked your blood pressure? When was the last time
So,
you
sorry,
checked?
Doctor. Um, so that's a question for us. When was the last time you checked your blood pressure? So, if you are watching this, I want you to type in the comment section. When was the last time you checked your blood pressure? When was the last time? Okay, you can go on. I'll be
Okay,
expecting our answers.
okay. So when was the last time you checked your blood pressure? You know, check it will let you know if you're on the right track or not. It will alert you if your blood pressure is going up, or if you need to start medications. And if you're on medications, you need to be consistent. Consistency help to preventing stroke. If you're someone that you days, and the next time you're taking it is on Thursdays, stroke is knocking at your door. Stroke is knocking at your door. So you need to check regularly, take your medications. And research has shown that salt has a big role to play in hypertension. Salt intake. If you are the type that uses both Maggi and salt in your meals, you need to stop that. You either go for salt or you choose Maggi. You don't use both of them together. I hope you understand what I'm saying. So try to reduce salt intake, excessive salt intake, a long way in preventing hypertension. Then your diet. You need to include more. It will really help. Then exercise. Taking walk 30 minutes every day. If you don't have money for registering to the gym, walks 30 minutes every day, it will really help. It will really help in your health, your mental health, your physical health. It will really go a long way in your health. Okay, so now I'll be talking about myocardial infarction. um People call it heart attack. That's what people really know as heart attack, but it's actually myocardial infarction. What is myocardial infarction? So, like I explained in stroke, when there is ischemia, when there is lack of oxygen, right? So, myocardial infarction, when there is lack of oxygen to a particular of the heart, which we call the myocardium. So, when there is reduction in oxygen, or when there is ischemia to the muscle of the heart, it leads to heart attack. Can cause the sudden what are the things that can predispose you to having an heart attack? There are a lot of risk factors, especially if you've had a family member that has had this before. Maybe you heard in the suddenly woke up from his sleep, he screamed, and as they were trying to rush him to the hospital, he died. That is most likely heart attack. Or someone you saw the previous night, and he came to the house and he walked in, and all of a sudden he's screaming, he's holding his chest, that is having severe pain, and from there he's gone. That is most likely myocardial infarction. So if you've had someone like that, if maybe a family member, first degree relative, especially your family, your immediate family, there's someone that like that has happened to you, you yourself need to get checked. You're not the type that should be very comfortable, or just live a sedentary lifestyle. You are the type that regularly to get your heart checked. Even if they tell you everything is fine, once in 3 months, you should visit the hospital. I hope you understand what I'm saying. So also
Yes, yes.
other causes, hypertension. Hypertension is a silent killer. It
Mm,
causes a whole lot of things. So hypertension is also one
yes.
of the risk factors that can cause myocardial infarction. Then if hyperlipidemia is also one of the risk factors. What is hyperlipidemia? Hyperlipidemia is when you have excessive fats in your body.
Mm, body.
So this is where exercise comes in. Once you have a lot of fat in your body, it can form the stone that I described earlier. It can
Mm-hmm.
clump together to cause something we call a plaque, and it will block a part of the vessel, and it can lead to a part of vessels of the heart, one of the coronary arteries, and causing lack of oxygen to the muscle of the heart, leading to heart attack. So how will this present? How will you know that this person is having an attack? We call it the Levine sign in medicine. So what is the Levine sign? Is when all of a sudden someone suddenly grabs his chest, the left side of the chest, and is holding his chest and is screaming is in severe pain. So that is the classical sign of action. That shows that this person is currently having myocardial infarction. So, and the pain can radiate to the jaw. The person can start feeling pain on the jaw, on the shoulder, on the left arm, on the back. And there can be other symptoms that the person can present with, vomiting, nausea. There are some can let you know that this person is most likely in an heart attack and you need to act very fast.
Yeah.
Then, if you're on medications like oral contraceptives that are so prone, is also one of the risk factors. So, how can you prevent, having heart attack or something we call myocardial infarction? Exercise, eating healthy. Try to yes, have ice cream, shawarma. I eat all of these things, but I try as much as
Mm,
possible to eat in moderation. You know, in moderation, because if you indulge too much, your health is at risk. Your health is at risk. So try as much as possible to stay off fatty meals, to stay off fatty fats, because this can predispose you to having it can lead to having hypertension that will lead to stroke. So all of this will help. Then exercise, you know your diet, taking a lot of water, going for regular health checks. If you cannot go to the hospital every month, you can decide that once in 3 months, at least once in 3 months, you should have your blood work pressure. You should check your sugar level, your fasting sugar level. You should do a fasting glucose. You should check your blood pressure, do your blood works, check your kidney function, check your lipid profile, and try as much as possible to try as much as monitor your weight, and it will go a long way. So what is pulmonary embolism? Explained earlier using the paper, and I also talked about the stone. So
mm,
what forms that stone that can block? It is either it is lumps of fat, blood cells, right? So once the plague, once pressure in between the vessels can burst and to a blood clot. So once that blood clots is pulmonary embolism. So what are the risk factors that can lead to? For one, if you had surgery, if you had a it's one of the risk factors. If you have varicose veins, what are varicose veins? So varicose veins are dilated veins that are usually found at the back of the leg. So if you notice any of your family member has, you can see an legs needs to get checked because one of the risk factors for pulmonary embolism. Then if you're on oral contraceptives, it's also another risk factor. Immobility. If the type of is like bankers now, they for a long time. So try as much as possible, even if it's every 3 hours, try to take a 5 minute walk around your office. It will prevent pulmonary embolism. So how will you know that the person is having pulmonary embolism? When there is a sudden shortness of breath, the person is suddenly gasping for air. Was fine a few minutes ago, and all of a sudden the person is gasping for air, the person cannot breathe. Sudden. It's a classical sign of that the person might be having pulmonary embolism. You notice that the person, the calf, that's at the back. If you at the back of your leg, if you notice that the person's leg is swollen, is not looking, is looking. So how can you prevent pulmonary embolism? Do not sit in one too long. Do not around your house every day. It's very, very good. Not to stay in one place. If you had surgery in the past, if you had maybe like a pelvic surgery or like a bone surgery, and I'm sure you were given some medications in the hospital, those drugs, it's one of the function of the drugs is to prevent blood clots. It's to prevent blood from clotting all of a sudden and traveling. So those drugs will prevent that from happening. Okay, so now let's go to the causes of generation. So number one cause, substance misuse. I'm sure we've all, gone to parties excessively. People are taking a lot of drugs, you know, cocaine, shisha, color, tramadol. Those are drugs that are very dangerous. In fact, now I found out that people are
Yes.
and they'll smoke it. So that is causing a lot of harm. And what those drugs, what they do is they cause an overdrive of the heart. They cause an overdrive. The heart that is supposed to function at, let's say, 100%. And all of a sudden, the heart will just give way. The heart will tell you that I'm tired of working. And from there, you will hear that the person suddenly fell down and the person substance abuse is a menace in our society, and it causes of sudden death in young people, or someone you suddenly hear that this person was in school, was in uni, all of a sudden the person fell in his room and is dead. When they do blood checks trying to test for drugs, they found that it's positive. So lead to sudden death in younger generation. Then there's something we call hypertrophic cardiomyopathy. So what is hypertrophic cardiomyopathy? Hypertrophic cardiomyopathy is a genetic disorder that's is genetic disorder is some is inborn, is in you. That means is in your lineage, is in your DNA. There's nothing you can do about it. It's a genetic occur. We can't they don't You don't know why they occur. You don't know how they occur. You don't know, which of your forefathers once had it. But it's something that has been in your DNA, that has been in your makeup, that is now expressing in you. So it's a genetic disorder that with a portion of the muscle of the heart. Let's just assume like this is, the muscle that covers the heart, right? So this portion, this part of all of a sudden begins to hypertrophy. When I mean hypertrophy, begins to get big, begins to get big, you know, of the ventricle, all of a sudden begins to get big. And the person is just walking and the person will just die. And it's common in athletes. That's the funny part. It's common in people that work out, people that are exercise gurus, footballers, athletes, people that the you know you will just hear that this person died on the pitch. You'll be wondering, this person has been healthy all their life. What happened? Is hypertrophic cardiomyopathy. So if you've watched this movie, A Man Called Otto, on Netflix, that was exactly what happened to him. He had hypertrophic cardiomyopathy. That was, classical diagnosis of hypertrophic cardiomyopathy. It's not something we that is so common, but I've seen one since I started, practicing, but it's not so common. But it happens, it happens. So if somebody, like, if you've heard a story like that in your family, that somebody, one of your young cousins, all of a sudden was running on the field, was very active, and he died all of a sudden, it's most likely hypertrophic cardiomyopathy. So, um, I'll just emphasize on, prevention. How can you prevent all of these things altogether? Number one, regular health checks. Check your blood pressure regularly. Check your blood sugar regularly. At least now we're in January, you can go to the hospital January, be in April. Every three months, it's checked. Even when everything is fine, the next 3 months go, because anything can happen. Anything can happen. So just get your health checks done regularly. Number two, your diet. Diet is very important. Choose Let your plate be colorful, not rice every time. Mix it with vegetables, with fruits, you know, chicken. Just try to spice things up. Try to incorporate vegetables in a lot of your meals. Try fruits. It will go a long way in your health. If you don't like, I know some people that don't like taking the fruits. They prefer smoothies. So if it's smoothies you want to go for, you're good to go. And try to um reduce a lot of oils in your meal. We have air fryer now. Air fryer mimics frying, and it will help you to reduce, taking a lot of vegetable oil. So if you can get an air fryer, it will help you fry your chicken, it helps you fry your plantain, your potatoes, your yam. And you realize that in a month you've not even had any reason to take in vegetable oil, or maybe apart from your stew, obviously use it for your stew,
Mm.
but it will limit the intake, right? And it will go a long way. Exercise, if you cannot afford to um if you cannot afford to pay for a gym, you don't the economy of this country now, we all know what's happening. So if you cannot afford to
Okay.
pay for gym, take walks around your house. 30 minutes every day. You get plugged ears and just walk around. And thank God we have all these apps now on our phones that will help you, count the number of walks that you have every day. And it will really go a long way. Reduce alcohol, stop taking alcohol intake. Then cigarette smoking, it's very bad for your heart, it's very bad for your health. Try to reduce cigarette smoking. Then how to try to manage stress. Stress management is very important. As sometimes you're in the hospital 72 hours, you are still there, you are still working, but try to find time to manage stress. How can you distress? Watch a movie, go on vacation, take a walk. If for me, I'm a Christian, so I enjoy praying, I enjoy worshiping God. If you're a Muslim and that is what you enjoy, it will help you to relieve stress. Try to find coping to relieve stress, because when it builds up, it's very, very dangerous for your health. It is very, very dangerous for your health. Yes, so I think that'll be all. Thank you so much.
Thank you so much. Thank you so much. That was quite enlightening. Thank you so much. Thank you so much. Hi everyone. I hope you're still there. Thank you for hanging in. So quickly, I think someone asked a question in the comment section, but before that, I'll just love to ask. So when you see someone that just probably slumps and then is down, is there something someone can actually do that could help? Is there anything like that? Can someone take a step, to do something to a person in that type of condition? Hi everyone. So I guess there's a glitch in the network. There's a network problem, and I guess we'll be right back. soon. I really do hope um, we gained or we learned something in this session. And if you have questions, don't worry, just drop your questions. They'll be attended to right here on the channel in previous in the next subsequent videos. Um, So thank you guys. Thank you everyone for staying to the end. Thank you so much. So right now we are going to be ending this section, calling it a day, and subsequently we'll be right back on your screen. A great day ahead. Take care of your health, take care of yourself, and remember, stay healthy. Thank you so much. So I'm going to be ending the live section now and get back.
Hello.
Okay, great, great, great. We have you back now.
I think my network just disappeared.
Yes, yes, I tried connecting back.
Oh, okay.
Great to have you back. It's great to have you back. Yes.
No, no, no.
Okay, so I said if we get to see a person who slumped and is lying down helplessly, is this something we can actually do to help? Is there something that can help the person,
Okay.
in any
Um.
way? Is there something we can do
Okay. So
as a
if
layman?
you suddenly see someone, that's the number is to call for help. Number one thing you should do is to call for help. If you are trained to give cardiopulmonary resuscitation, that's what we call. If you give chest compression, you can start with that. But the first thing is you call for help. Call for help before you even start cardiopulmonary resuscitation. As you are resuscitating the person, help is on the way. So if, like in developed countries now, you can easily dial 911, or you can easily call the emergency line. I think some states they have such numbers. So it is very good to have such numbers on our phones in case of any emergency. It may not even be someone that you don't know. It might be your family member. It might be someone that is very close to you. So if you have um sorry, Nepa just took light. So if you have
This is Nigeria.
someone someone is it's and it will be of a great help if you can learn how to do cardiopulmonary resuscitation. There are
Yeah, it should
trainings
be very
all
good.
over now that train
Yeah,
people. Even if watching YouTube, you can watch
yeah.
YouTube. There are a lot of channels on YouTube that will teach you how to do cardiopulmonary resuscitation.
Yeah. So this is to tell everyone on this chat, please, please, if you don't know how to do CPR, please go and learn it. You can get to learn it free of charge. Go on YouTube, just search. We can't say it can just be of help to someone one day. So
Yeah.
please and please do learn how to make a CPR. So someone asked me a question, and I said I'm going to ask you. Probably what he has been hearing is that people that slum, okay, when you hear slum, what comes to your mind is like, okay, maybe the person fell down inside the phone. Probably the incidents he has been hearing is like everybody that's been slumping that have been hearing, why is it always from the bedroom? Maybe when they finish bathing or they finish touching water or something. So I want to ask, is there actually a relationship between the bedroom, water, and then you slumping
You
and dying?
okay? Most of our bathrooms here, especially in Nigeria, the way is designed. Once there is water, it can be slippery. It can be very slippery, especially with the bedroom common one. very, very slippery. So it's one of the major areas that you see patients, the relatives that that's like the first point where they will slump and die. And stroke weakness. The person who walks into the bathroom, the person is trying to have his bath. All of a sudden, the person feels this sudden weakness on one side of the body, and the condition or the environment is already slippery. Is already anything can happen. Even normal people, as you are very fine and very stable, fall. So I think that is why it's common in the bathroom. But I don't think there's no there's nothing medical about it. Maybe touching water. I think it's more about thing.
Yeah, thank you so much. So, if you have questions, we are right there in
I
this
think I
live.
saw a
And if you have
question
questions,
before I left.
okay.
I think someone was trying to, find out. Please explain hypertrophic cardiomyopathy again. Okay, so hypertrophic cardiomyopathy is, like I said, disorder. Mm? Is a genetic disorder that affects the left ventricle. There are different chambers of the heart. There are different big vessels or chambers, like, yes, of the heart. So one part is the left ventricle. We have the right ventricle, you know, but the left ventricle, that is where the attack is. So, and each of these vessels, they have muscles around them. So one of them is what we call. So when there is an asymmetrical hypertrophy, when I mean hypertrophy is the muscle suddenly goes big. What's causing the bigness? It's not like the person is smoking. It's not like the person is drinking. It's not like the person has hypertension. It's not like the person has disease. It just goes big all of a sudden. And that is why I said in my first statement, it is a genetic disorder. It just happens. It's in your DNA. There is no explanation for it. You can't say this is why you have it. Do you understand? There are some medical conditions that once a family member of yours have it, the chances, in fact, majority of it, even hypertension, even diabetes, once you have a relative that has it, you can come down with it later in life. Do you understand? Same thing for hypertrophic cardiomyopathy. It's a genetic disorder. It's inborn, right? It's in your genetic makeup. Maybe one of your four fathers had it and died. Then it can now come in your own generation, maybe the sixth, now come down with such condition. So that cardio. I hope you understand what I just explained.
Thank you so much. Thank you so much. We just have the time to entertain just one more question. That if you have any from the audience, do we have anyone with a question? Thank you so much, Shewa. It's been a great
Thank you,
time
ma.
with you. Actually,
Thank
thank
you,
you so much.
Daniela.
And yes, I
Yeah.
learned something new.
Okay.
I learned something new. I'm sure everyone here has something to say. It's so enlightening. Thank you so much for
Yeah. I'm
shedding light to
happy.
a lot of things. Yes.
Right.
And I hope we get to do this more.
Hopefully, by God's grace.
Yes, thank you so much for your time. Really
Thank
appreciate it.
you. Thank
Thank you so much. And if you are watching and you've not subscribed to this YouTube channel, please do well to subscribe. Dr. Shewa, help me to tell them to subscribe.
you. Oh yeah, you guys, please subscribe. You know, getting us enlightened about things like this, and it's very, very good. So please subscribe.
Yes,
You have to subscribe.
yes. Yes, do well to subscribe. Thank you so much.
Thank
And
you too.
yes, you can watch this video later. Probably you have your family or your friends to share with. It's going to be saved on the channel, so you can come back to it.
All right.
Thank you so much for your time. Bye
Take
everyone. Thank you,
care.
Dr. Shewa.
Bye.
Thank you. Bye. See you.